All right, welcome everyone. This is a series. We're doing a series of different kind of Medicare information for everyone. This one is called Understanding Medicare Part B, which is supplementals. As I said, Lisa Pino is our host this evening, and she was from Norwescap. So Lisa, welcome to the Parsippany Library, and please, please take the show. Just do your thing.
Okay, I will. Thank you. Well, hello, everyone. I'm glad you all came tonight. And this is about understanding Medicare Part B. So we're going to go over a little bit about Medicare as a whole, briefly, so you can understand where the supplementals come in. And we're going to give you a little advice on how to choose that for yourself, just so that you can make an informed choice. Now, first of all, the Medicare Basics here. I'm going to try and move this out of the way. Sorry. Okay. We have Part A, of course, hospital insurance. That covers all of your hospitalization. We have your Part B, which is your doctor and your outpatient care. And that has a premium, which comes out of your Social Security check, and a deductible for the year. Now, those two costs do change from year to year. I do not have those figures for you right now. They are supposed to be released shortly. I have been told approximately $10 increase on these. This has not been confirmed. This is just what I've heard, but at least you'll have an idea. Now, Part B works with a Medicare supplement to give full coverage because Medicare covers 80% and you have to pay the remaining 20% of the bill. One thing that is very important, however, and this goes for any part of Medicare, I do have to tell you, please make sure when you are calling doctors, facilities, when you enroll in Medicare for the first time and you're trying to make sure that your doctors take Medicare or you're going to a new doctor, don't just ask them, do you accept Medicare? They're most likely going to say yes. They'll take it, but you will not receive full coverage all of the time. You have to ask them, do you accept Medicare assignment? And please use those exact words, because this means that they have a contract with Medicare and cannot balance bill you. If they can balance bill you, you will be paying a lot more than that 20%. Okay, so that's very important to remember. But your 20% is what you want to get covered with a supplement. So that's the part of what we're going to go over today and give you a little more information about. Now, Part C, and this is the part that people are not always quite sure what it is and what part it plays. It's Medicare Advantage. Now, this was brought into play because original Medicare, when it started and has been for years, was quite costly for a lot of people. So this was kind of a test to be brought in to see if they can lower the cost for some individuals that couldn't afford to pay for each individual part of Medicare, the premiums, plus all of the deductibles, plus any 20% charges or any balance on their supplementals that they had to pay according to those insurance policies. So this may or may not include a drug plan, but it does combine parts A, B, and your supplement into one plan. Now, usually the premiums are a little less with something like this. However, the difference is you're going to have HMOs and PPOs here, meaning that you're going to have a list of doctors that you have to see in order to get the best coverage or any coverage at all. You may be restricted to a certain area. I'll get into that a little bit more later, but that's the basic understanding of this and where this fits in. Now, Part D is drug coverage only. Again, that is a separate premium and a separate deductible. And that varies from the plan that you choose. Now, right now, the premium is $148.50 for Part B, which comes out of the Social Security check for most people. The deductible right now is $203 for the year. So once you reach that, Medicare, your supplement and your Medicare will kick in and pay the rest. Okay, your supplement will pick up that 20%, of course. Now, of course, the rates for 2022, as I said, have not been released yet, but I expect them fairly soon within the next couple of weeks. And just a little tidbit of information, the cost of living increase for the Social Security checks that you have will be 5.9% this year, this coming year. Now, Part B defined, in a nutshell, it is offered by the federal government. It does cover your doctors, outpatient care, some physical and occupational therapy. And after the deductible of $203 or whatever the increase is going to be, Medicare will cover the 80%, and then you have to pay the 20%, or your supplement plan will do that. Doctors and facilities do need to accept Medicare assignment, as I said, in order to get the best coverage that you can have. Part B supplements are offered by private insurance brokers. Okay, you need to know that. Some people come to us and think that we can sign them up for the supplements. We cannot do that with original Medicare. We can do that with Medicare Advantage for your HMO and PPO plans. If you want to stick with the original Medicare, though, you do need to go to a private insurance company for that. Where we come in is we help you decide on a non-biased opinion, because we are
Lisa,
not
you're
affiliated with any insurance companies at all. We help you make that choice. We could do side-by-side comparisons, and we could show you what plan might be best for you based on your financial situation and your medical situation. How do I sign up for Part B? Well, it is best to sign up when you first become eligible. That is 3 months before you turn 65, the month of your 65th birthday, and 3 months after you turn 65. So there is a 7-month window there. Now, you can still apply after that, but you may not be accepted. They could actually turn you down, or you may not get the best rate. What happens here is during that 7th-month window that you become eligible, they are not allowed to subject you to medical underwriting. Okay, so when you go to look at a supplement to cover that 20%, by law, they have to give you the rate that they would give any other healthy person. They can't ask about pre-existing conditions or anything else. So that is your ideal time. That's probably the best rate, the lowest you will be getting with Medicare at that time. Now, this is just original Medicare. I went over this a little bit just about Medicare on a whole, but this is strictly how original Medicare operates. You have your Part A for hospitalization, your Part B that's offered by the federal government. You have your premium coming out of your Social Security check. You have the deductible that does need to be met before Medicare will pay the 80% of their portion. And then you have the 20% that is hopefully covered by your Part B supplement, otherwise known as a Medigap. Okay. For original Medicare, the supplements are known as Medigap plans. They are offered by private companies, and the premiums vary, the deductibles vary, and how much they're going to cover of that 20% will vary based on the plan that you're choosing. Your drug plan is the Part D plan. It is separate. They do have premiums and deductibles for the year as well, and those vary as well, depending upon the plan. Some original Medicare facts here for Medigap plans. All of the plans are separate with separate premiums and deductibles. This can be costly, paying premiums for each different part, deductibles for each different part. Your 20% for your drug plan, your Part B plan, a supplement that you're responsible for. So that is why the Medicare Advantage portion came in later as a possible alternative that may be a little less costly. It just depends on your financial situation and your medical situation. The good thing about this, it can be taken anywhere in the US. So If you're a snowbird and you like to spend maybe 5, 6 months out of the year in Florida, let's say, a Medigap plan would be a good choice because you cannot take a Medicare Advantage plan with you since you are restricted with your doctors and your facilities. However, if you're going on vacation for a week or 2 weeks, you will get coverage. You will get emergency coverage regardless of what plan you choose. They do all have emergency coverage. Now, these plans can have deductibles, and the deductibles, as I said, vary. To enroll, actually sign up for a Medigap plan, you do have to contact a private insurance broker. And the Medigap plan that you are interested in does have that information. In fact, we have those, we can find out those numbers for you in that contact information. You must have Part A and Part B first in order to purchase a Medigap supplement plan. That's important to know. Now, Medicare Advantage, this is the part that came in for a more cost-effective, hopefully more cost-effective way to handle Medicare and take part. Usually the premiums are lower. It does encompass all Part A, the hospital, the Part B, which is your outpatient and doctor care. And it does include coverage for the 20% supplement that you're responsible for, that gap there. It can have a drug plan included. Most of the time, it does not. Usually, especially going into 2022, certain situations have to apply for that. They do usually have copays. Not all, but most of them do. The copay costs will vary depending upon the plan. So that is something to consider. This is in addition to the premium that you might pay and any deductible that might be there as well. Now, they are HMOs and PPOs, which means that you must stay within the list of doctors and facilities on the plan in order to get the most coverage. Some plans include dental, some plans include vision. Not all of them do. And you cannot purchase a vision or dental plan separately. The only way to look at anything like that would be to get a Medicare Advantage HMO PPO plan. Which plan is best for me? First of all, think about the following: the cost. Can you afford the premiums, deductibles, and copays on the various plans you're looking at? Which one is best? Then you have to start looking at the benefits based on the cost. What does it cover and not cover? They may have a high premium, but there is a couple of Medigap plans where you pay your premium and deductible and you don't pay anything else for the rest of the year, literally nothing. Now, the premium is on the high side, but it just depends on your medical situation. If you're someone who, say, has to see a specialist on a regular basis, if you have a lot of medical issues, you're going to be going to the doctor a lot. Maybe it would be better for you not to pay anything after you pay your premium, as long as you may pay your monthly premium and meet your deductible. Then again, if you want to switch and kind of look at a Medicare Advantage plan, you have to find out, are your doctors and facilities of choice on that plan? Are they on their list? And if it's a Medigap plan, do your doctors and facilities accept Medicare assignment? Are you willing to switch? Are you willing to change doctors? Now, just because you're on an HMO or PPO, if you take the Medicare Advantage, that doesn't mean that you have to stay in your county. You do have to stay in your state. There are some plans that are only for Morris County, but we have several plans that could allow you to go to Morris, Warren, and Hunterdon counties. It varies. There are many different plans to look at. So it's not that you don't have any flexibility at all. It just varies. Look at your health history. As I mentioned a little bit before, how often do you need to see the doctor? Do you have a chronic condition? If you choose a plan that has copays, you're going to be paying those copays every time you go. So you do have to factor that into your cost. Keep in mind too, your health can change over time. And prescription drugs, does your plan include them? If it's in a Medicare Advantage plan, as I said, that's rare, but your situation may qualify for something like that. Now, if not, how much you're going to be paying for that separate plan, because you're going to have to factor that into your overall cost per month and per year over the course of time. Make sure your drugs are covered and check the copays on each one. that is something we can help you with here as well. We can take a look at every plan that's there in 2022 and beyond for the following years as applicable. We can look at your drugs, any prescriptions you're on, and see if they're covered, how much you'll be paying, and see what plan will give you the most coverage. And I do highly recommend, people make this mistake a lot, and I strongly advise against it. Always take a prescription drug plan. Even if you don't take any prescriptions now, you do not want to pay a Part D penalty if you can help it, because that Part D penalty is permanent. It is permanently attached and withdrawn from your Social Security check. Once you do finally decide to take a drug plan, take the cheapest drug plan out there. There are drug plans that are extremely cheap. I mean, $11, $13, literally a month. Just have it so that you don't have to take the penalty. When you do have to get prescription drugs, you at least have some kind of coverage. And then during open enrollment, we can always find a better plan for you. But at least you will not have to take that penalty and you'll have some sort of coverage in case. Additional benefits. Please take advantage of the preventative benefits that Medicare offers. They are completely free and they're covered under Part B. Now, these are explained in the Medicare and You Handbook. You can also go to www.medicare.gov to view the preventative benefits that are there for everybody who joins. If you do need a Medicare and You Handbook, let us know. Our office can send that to you. And there is still, in effect, COVID-19 coverage, of course. They cover the lab tests, any necessary hospitalization, including if you need to stay in the hospital for quarantine. The COVID-19 vaccine and boosters, which are covered under the Part D drug plan. They cover telehealth as well. So that's very important to know. And that is continued. They're not going to discontinue that. Most importantly, what if you need help? That is, everybody does at one point or another. And you need to make an informed decision and have all your questions answered, of course. So please call us. We are Norwescap Incorporated. We are a nonprofit agency. We have many SHIP counselors here, over 20 throughout Morris County. We'll be happy to assist you. We can assist you over the phone. We can assist you virtually. We can assist you in person. And this goes with all aspects of Medicare. It does not have to be open enrollment for you to call us. You could call us anytime during the year with any questions you may have, as far in advance to your open enrollment time or in advance to your time of joining Medicare. Okay, so do not hesitate, please. These are your tax dollars at work. Feel free to please reach out to us. And more importantly, too, if someone you know has trouble paying their medical bills, or if you have trouble, there is assistance available that most people are not aware of, unfortunately. So many do qualify. This can include reimbursement of the Part B premium that comes out of your Social Security check, and coverage for prescription drugs, extremely important, and the premiums that you're paying on those Part D plans as well. Especially for the prescription drugs, the income allowance is quite high. So you would be surprised how many people actually do qualify for this. Not everyone, of course, but most people are very surprised. You don't have to be on a Medicaid level or food stamp level to qualify for these programs. That's important to know. So our number for the Rockaway office is 973-784-4900. And we try to connect you with a counselor that is closest to you, so you don't have to travel too far. And please be aware of scams. If you or anyone you know is a victim, or you have any questions on phone calls you may have received, things you have gotten in the mail, please contact us. We have people that we are in touch with at the state level that can help you with this. They can even file an inspection of all of this type of thing on your behalf, and they can take over and just look into this for you to make sure you are not scammed. So that is very important. Unfortunately, there's more out there every day. So, and here is our contact information. I could also email these slides to Eugene if you want to hand them out, if anybody needs any information, just for a referral, whatever is needed, we'd be happy to do that. So
that would be great. I would appreciate it.
Sure. Any questions at all?
I actually have two questions.
Okay.
One question is, if so, you're saying a Medigap can be used in different like for instance, if my husband lives in New Mexico and I live here,
Mhm.
and we're going to be going back and forth between New Jersey and New Mexico.
Right.
So we would want to do a Medigap.
Yes. If you were just staying for a week at a time, no, you don't need to worry about it. But if
Okay.
you're going to be staying for a month, 2 months, 3 months, yes, that's what you would need because your Medicare Advantage plan will not travel outside of New Jersey. It may
Okay.
not even travel outside 2 or 3 counties.
Okay.
So, yeah.
Okay, good. Good to know.
Yep.
And Dawn, I got your message. Does anyone else want copies of the slides? Anyone who signed up for anyone who registered for the program, I will send the slides to. So if you
Perfect.
don't want the slides, then I would need you to email me and let me know you don't want them. So everyone will get them. Thank you, Lisa. That's great.
Sure.
You're welcome. So are there any questions? Please unmute yourself if you have any questions, even
Yes.
if you don't think that they're relevant or important. Please absolutely unmute yourself and ask your questions, or you can write them in the chat. That's fine too. This is a really good time to ask questions because Lisa is incredibly knowledgeable, as is Charles, and they have answered a lot of questions that I thought were kind of screwy, but
And that's another, if you have an unusual question, you think,
yeah,
feel free to reach out. I mean, we could talk about
Sure.
that privately as well. Sometimes they're a little lengthy. Sometimes they take some research, and we have no problem doing that. We may have a lot of knowledge and answers, but we don't know everything. And sometimes we do have to do some research for you, but we have access to that information. We have people we can ask at the state level, and we've done it before. So don't hesitate.
Right. Okay. Okay. That's good to know. So what do you think? Anybody have any questions or any comments about this program? I would like you all to be aware that on Tuesday, November 16th, which is next Tuesday, we're going to be doing the Medicare Part D drug plans. So if you feel good about Part B, but you're not real sure on Part D, then go ahead and sign up and we're going to have another program on that also.
Right.
So any questions? I guess everybody knows what they're doing.
Well, even if you think of questions later, a lot of times that happens, feel free to call. We're here.
Oh, wait, somebody just raised their hand. I just don't
okay.
know who it is. Oh, they're clapping.
No.
Clapping? Oh, they're clapping. Sorry, Dawn.
Well,
Now I
thank
get
you.
it.
Thank you for the
And
clap.
there's a little heart. Okay.
Aw.
Thank you, Dawn. We appreciate that.
Thank you.
I do have a question. So it's always 3 months. So my husband's birthday's in April. He wants to sign up in January. Is that correct?
That is when he should probably start looking. I mean, he can wait. He's got that 7-month window, but I would definitely start looking into this in January. Yes.
Okay. And you absolutely think it's important to sign up for a drug plan, even if it's the least expensive drug plan, because we would then get a penalty to add a drug plan
later on. If you miss that open window that you have, yes, you most definitely would.
Okay.
Important to know though, this is for retired people who have no other coverage. If you are still working or you're taking a retiree plan, please contact us as well as your human resources department to find out how that would work if you decided to keep your workplace coverage or your retiree coverage.
Okay.
They can work together, and you might not need to take a Part D or even a supplement at that time. Then you would be exempt from that Part D penalty. But everyone's situation varies, so we really need to talk to you.
Okay. All right. That sounds great.
Okay.
I was kind of hoping there would be more questions because it is only 6:20, but it's I guess
it's a lot of information. Sometimes it's very overwhelming too. So it's okay. Sometimes they come later.
Yep, they'll come later.
Yeah.
Well, I want everyone to know you can email me, and I will put my email in the chat. I'm pretty sure everyone knows that. Hold on one second, everyone. But if you don't, I'm putting it in the chat. And you can always email me if you want to get any other information from Lisa or Norwescap. I can always, get you in touch with them. It's always a good idea. Like, I take pictures of things that I need to, keep on my phone so I can go, oh, there it is. That's that.
Right.
All righty then.
Okay.
Well, if everyone doesn't have any other questions, Lisa, thank you so much. I really appreciate all this
Sure.
information.
Anytime.
Lisa's going to send me the slides, and then I will send them in an email to everyone. And I thank you all very much and have a good evening.
Okay, you too.
So good night, everyone.
Good night.